Dr. Lal, even Metropolis, all of them in quick time have gone up by 10 to 15%. The logic is very simple. Second wave of COVID means more testing. More testing means more top line for diagnostic firms. So let's talk about business environment. What is happening with the diagnostic business, and if the second wave is here to stay, what it means for us as Indians, and what are the patterns which currently are there in the second wave, and how is the second wave medically different from the first wave? To discuss all that and much more, I have with me Mr. A Velumani, Chairman of Thyrocare Technologies. Mr. Velumani, good morning. Thank you for joining us. Normally as anchors, we throw pointed questions at you, but today a lot to discuss on the business front, on the medical front, and also on what is happening to the entire state of Maharashtra. What do you want to start with, sir?
What is happening to the entire state of Maharashtra? So, according to me, something is wrong. 50% of the national increase in the infections is in Maharashtra, and 50% of Maharashtra load has increased in Mumbai alone. It's very sad to see the numbers rising. Somebody pointed out even the deaths per day is rising. I was thinking that it will be only infections per day, not deaths per day. Having said that, is that a new variant? Is that the new variant spreads faster but safer? Or is that new variant spread faster and equally bad? This is something answers are still not known. I was thinking that we would escape from number of deaths. The infections accounts will go up because as such virus has not vanished. So if you ask me why Western India, Maharashtra, Mumbai has such a huge load is not scientifically explainable.
Velumani, based on the medical evidence, which is that how second wave is always more brutal and more powerful than the first wave, that is what history of evolution has taught us. Are we at least 2 to 3 weeks away before we reach a peak, or the vaccines will start breaking the chain soon?
No, I don't think we have enough of past data to predict the behavior of virus, because I am 60 years old. I have never had a situation of this nature in any part of my life. Having said that, if Western world had a very bad second wave, even third wave, it is because they are not getting an immune response faster for the virus and they are struggling. In India, if we have seen deaths per day from 1200 to coming down to 100, was it purely lockdown? Or was it herd immunity? Or was it doing a rapid antigen test and showing a less number? Or is it under testing to bring down the number faster to bring up the economy? I am confused completely. But having said that, is that all states are testing like Maharashtra? Answer is no. Is that all cities are like testing like Mumbai? The answer is no. In Mumbai and Maharashtra, the testing is high because the infections are high, or infections are high because the testing is high. I think you need to ask analysts to find out what is the data saying. According to me, this wave will not be able to do the same damage which first wave did. I'm very clear about it.
Okay, thank you for that, Mr. Velumani. Now let's let's understand the business of diagnostics and diagnostic labs. Given that number of testings have gone up, all of us are perhaps when we're traveling, we have to get ourselves tested. It's a compulsion now. How has that changed life for Thyrocare? and also for the diagnostic firms?
Yeah, I think the entire industry was doing a peak number of tests RT PCR at a very good rate, somewhere around 1500 in the month of August and September. It looked like it is going to truly contribute substantially to the top line and bottom line of the diagnostic companies. But then came the unilateral price cuttings across different states. And it is sad to note in some states still it is 3,000 rupees and in some states it is only 400 rupees. It is not that locals खेती में reagent नहीं आते, it's global. But having said that, the price capping has affected the diagnostic industry, number one. Number two, the number of deaths were 1,200 per day. Everybody wanted desperately very fast to get tested, but it had come down to 100 per day in the first week of February. So the tests had come down. What was around, I would call in absolute numbers of, 20 crore per month had come down to 5 or 6 crore per month. But suddenly, the last 8 weeks, it has gone up by 5 times the volume. And with low, still it is making profit. So I see a diagnostic industry to have, I don't know, for a few months or few years, COVID will remain as a biggest revenue giving test in the laboratory segment.
Sure. And just to take that point forward, Mr. Velumani, just wanted to understand whether you think a mandatory RT PCR, which under the mini lockdown guidelines announced by the Maharashtra government as well, for instance, even essential staff or daily staff entering into buildings should be, is suggested to take RT PCR tests at a regular interval. You think even offices would make RT PCR a mandatory test, and this is something that could, go on till the virus exists?
No, from the last 1 year, it is very clear diagnosis is not changing the management of COVID. It only helps to quarantine and minimize the exposure. So if government insists all have to do, if you have no business justification to do the test, you close down the business. But if you have to run the business because of the overheads, this will be one more overhead. According to me, it may not give any clinical outcome, but certainly it will make us to understand what is happening with virus in this geography, which age, how fast. So all those things, only when you do COVID testing, you will come to know. But one important point I want to mention, there is an increase in the number of deaths from February 1st week to April 1st week. But they are all death with COVID. Are they death due to COVID? It is not studied. Death with COVID is not because of COVID. Population has 5-7% of infection, diagnosed or undiagnosed, tested or not tested, vaccinated or not vaccinated. So it is important that we study, is COVID causing these deaths, additional deaths, or is it additional deaths are labeled as COVID? This is very important for us to understand so that philosophies and policies of all government, administration, bureaucracy can be fine-tuned.
I get your point. Is there some data or established data, if I can call it that, Dr. Velumani, with regards to testing? Over the weekend, for instance, in Mumbai alone, BMC held a lot of camps across various, housing societies, testing people as well. But is there any data to establish whether testing has actually gone up as well?
Gone up. Mumbai laboratories in Maharashtra are testing to the brink of their capacity. There are collection challenges, there are testing challenges. So laboratories number says, I myself have traveled from 2,000 per day from the first week of February to last Sunday, 10,000 per day. Now for a Sunday, generally it is 40%, 50% of the weekday load. 10,000 per day is a matter of huge stress. I am pretty sure everybody is panicked. If someone is tested positive, the entire family is getting tested. Tests have become affordable, so testing is done more. Testing is done more and positive is reported more. And positive is reported more is causing panic.
Understood. Dr. Velumani, given that regardless we are going into a spate of restrictions and lockdowns across certain parts of the country, given what you've said, of course, you're talking about prevention being more important than perhaps some of these measures. But in terms of the situation in hospitals, for instance, is that something you see easing? Give us a sense of where we're at in the current cycle, because there are also fears that while Bombay might be super congested, that other parts of the country will gradually start to follow suit, given that that's the pattern we have seen previously.
According to me, the quarantining is happening at home. Good number of families, entire families are locking the door and taking rest and combating the virus. This was not happening in the first wave. In first wave, more panic was there. Second wave, less fear is there. When I say less fear, it does good also, bad also. Less fear makes people not to worry about the safety guidelines, and less fear does good because panic is far less. Having said that, the rich still feel hospital is safer place, so they move to the hospital, whether they need a hospitalization or not. So hospitals, according to me, are 90% beds, COVID beds are full, not because it was compulsion, because it was an option and people could afford to. I don't see with the numbers as bad as what it was in the peak of first wave. Hospitals struggling as bad as that. So in my personal opinion, herd immunity is working. More is tested, more is reported, but more is dead not because of COVID. It is with COVID positivity for various other comorbidities. We are labeling them as COVID deaths. I think a very careful analysis is very important at this stage to understand whether this deaths increase is because of COVID or they are dead otherwise and COVID is only positive in such cases. If this research is done, very easy to do, little more peacefully we can pass. Because it has happened like this in some parts of the country, the worry is if you start testing in all parts of India, all districts of India, the scenario may not be very different. So it's very important to study the increase in death. Is it alarming or is it a part of life?
Okay, fair enough. You've also talked about testing, of course, and how it's definitely seen a manifold increase. In terms of that, and in terms of business, Mr. Velumani, anything else you want to share with us going forward, what the outlook is looking like?
No, diagnostic companies are, you can see for the last 3-4 days, almost all companies are rallying. It rallied in the first peak. It will rally in the second peak. Whenever there is a peak comes, people think that it is going to do well. That's about the stock market. As far as business is concerned, for us, this quarter will be a very unique quarter. There is a likelihood a quarter over quarter of 300-400%, not because of anything except that last year this quarter completely collapsed. So we need to take care of the ups and downs. Otherwise, business is fairly smooth with the normal challenges of business.
Mr. Velumani, you rightly said that same time last year the business collapsed because of lockdown. The only testing which was happening was the compulsory testing of COVID. This time, let's say the state of Maharashtra and city of Mumbai. What has been your experience? The non-COVID test, the home services, people who want to get themselves for other illness and other things. Is there a change there?
No, overall, I have been telling we have spent trillions of dollars across the globe to make man aware of health. And dar gaya, man is very scared. So if you ask me, the non-COVID business is in this peak not disturbed. As much as in the last peak, people felt COVID is the only problem. Today, people know that COVID is one more problem. So we don't see any dip because of this second new wave on the non-COVID side.
Mr. Velumani, the COVID test rates have really come under check. There is a cap there. But I'm sure in last 1 year, the cost of material and the cost of doing a COVID test, and now that you have understanding and scale and size is there, are you making more money on the COVID test than versus what you made same time last year?
No, actually the percentage of margins have come down, but volumes have gone up. Incidentally, after the peak, which was in September, when the deaths per day had come down, when testing per day came down, when rapid antigen test was mercilessly used, the RT PCR manufacturers had too much of stock in hand and too little demand. So they came down on rates very fast. You asked the rate, you got the rate. This is a story only till March 1st. In March 1st week, people have understood that there will be a big second wave peak demand. So the vendors are again not truly keen to supply at the same terms which they supplied in February and January. But the rates, government reduces, it doesn't increase. So there may be challenges for us to manage for profits with the control of the government and with the demand of the market. Both are going to trouble us.
Appreciate your time. Thank you so very much for sharing your thoughts and walking us through what your understanding of the COVID situation, at least in India and especially in the state of Maharashtra is. Let's take a break. Markets are not looking bad at all. In fact, there are some spikes which are visible in autos. Metals are holding on beautifully. And the star today, yet again, if I may use the word, is Tata Motors.